Healthier Together, sponsored by Regents Blue Cross Blue Shield of Oregon.
What if I didn't do it? What if I just do nothing? And he said, you'll never run again. And then maybe when you're 60, you can get a knee replacement.
Osteoarthritis in the knee affects millions of people, but one local man is seeing some hope in getting moving again. OHSU is the first in the nation to use a leading-edge repair technique to treat osteoarthritis in the knee. Brittany Falkers met the first patient in the country to get the treatment after FDA approval.
Despite the osteoarthritis in his knee, Thomas Proctor is hitting the pavement again.
I love to run. If I can't run, I feel like I'm need a fix.
But it's not a new spring in his step. It's actually a shock absorber in his knee.
It's a pretty substantial thing to have an implant, but I think the worst option would be to never run again.
He's the first patient in the nation to receive this leading-edge surgical treatment, essentially implanting a shock absorber to repair his knee.
And he showed me the x-ray where my bones are just about touching, and he said, but there's this thing, a brand new thing that you might be perfect for.
And after surgery, he was jogging again in just weeks. But the process to get to this point took much longer.
You know, we've been looking at this technology for more than a decade.
Dr. Dennis Crawford and OHSU were part of a series of clinical trials to ensure its safety and efficacy. Dr. Crawford describes it as the most notable advancement in treating knee osteoarthritis in half a century.
Right, I do explain it like a mountain bike shock for people, because what it does is when we step, it takes that stress and dissipates it through the mechanics of this small device. It's about the size of your pinky. It's placed underneath your skin in a surgical procedure.
It's an alternative to conventional knee replacement surgery, and it has the potential to help certain patients like Proctor by intervening earlier on.
You know, this is a disease that we don't want to necessarily wait to take care of until the end. You know, most things we like to take care of when we first notice them, right? And I think what this device and hopefully others and other therapeutics in this domain will do is start to say, hey, this is a disease that doesn't have to get to the end. Maybe we can affect it by keeping people healthy and active.
In April, the FDA authorized the treatment, and Proctor was the first outside a clinical trial to get it.
I just wanted to get back out and do stuff.
And now he's picking up pace, getting back to the active lifestyle he loves.
That was the other part of my motivation, was like, yeah, there's no way I'm not going to go back out.
Well, the procedure isn't right for everybody, and Dr. Crawford is realistic about insurance and other hurdles that would come with a new treatment, but he's hopeful of what's to come. To learn more about the procedure, you can visit kgw.com/healthiertogether.